Good evening, class. Welcome to DLA 1970, Recognizing Ischemic Heart Disease in Young Women. I'm your instructor, David Alexander. I'm a physician assistant at the Piedmont Heart Institute in Atlanta, Georgia. A brief description of the course you're about to take. This is a 4-week e-based course targeting primary care advanced practice providers. And the reason it's an e-based course is because many advanced practice providers have a hard time getting away from their practices to attend formal courses. In addition, advanced practice providers need continuing education credits. So this is certainly a convenient and cost-effective way to get them. This course is designed to increase their knowledge and understanding of heart disease in young women. The textbook for this course is Braunwald's, the 2014 edition. Let's talk about objectives for a moment. The first objective is to recognize typical and atypical symptoms of a woman with ischemic heart disease. We want you to describe the appropriate management of a young woman with symptoms of ischemic heart disease. I want you to identify common misconceptions regarding young women presenting with chest pain. That's going to be important. We want to talk about the mechanism by which hypercholesterolemia leads to heart disease. Most people know that cholesterol causes heart disease, they just don't know how. So we want to talk about that a little bit. We also want to talk about some modifiable risk factors for cardiovascular disease. And finally, at the end of this course, there'll be a brief multiple choice exam which you must pass in order to pass this course. Okay, so briefly, acute myocardial infarctions, or AMI, is the leading cause of death in young women. And Lichtman and colleagues note that many young women presenting to their healthcare providers with typical and atypical symptoms, which were later diagnosed as myocardial infarctions, were misdiagnosed. Now think about that for a second. They're misdiagnosed. Many advanced practice providers have a general lack of understanding when it comes to identifying and managing young women with cardiovascular disease, and that is the reason why we thought this course was important. Women are diagnosed less than men, and women often underestimate their own risk. They feel that because they're women, they can't possibly have heart attacks. Women have symptoms that are not typical of heart disease, and evidence would suggest that women's ischemic heart disease symptoms are often less scrutinized than men's. And because of that, women tend to suffer worse outcomes than men. In fact, coronary artery disease is the #1 killer of men and women. A quarter of women in the United States and around the world die from heart disease each year. And coronary artery disease is the leading cause of heart attack in women. There are several misperceptions and misconceptions of heart disease. Many of the women that present with chest pain in our practice think that breast cancer or skin cancer, either one of those, is the #1 cause of death in the United States in terms of women. However, heart disease is actually #1. As you can see from this slide, heart disease is #1, followed by breast cancer, which is a distant second. Okay, so keep that in mind when you're discussing the causes of death in women with your patients. There are many myths and facts associated with women and heart disease. For example, women think that heart disease is a man disease, when in fact, again, as I said earlier, most men are likely to be diagnosed. However, more women are likely to die from this disease because they are misdiagnosed. Heart disease is for old people. This too is a myth. Heart disease doesn't affect women who are fit. That is also a myth. Very active women who do not have any history of heart disease and who do not have any symptoms are still at risk. Again, heart disease is the #1 killer of women worldwide. It is the biggest killer of women worldwide. I can't stress that enough. Heart disease runs in my family, so there's nothing I can do about it. And I added this because one of my patients said that to me just last week, when in fact nothing could be further from the truth. Women do not have to have a family history of heart disease in order to have heart disease. I want to talk about some modifiable and non-modifiable risk factors. The non-modifiable risk factors for heart disease are the ones that you might suspect. You can't change your sex, men or women. You can, but it doesn't change your risk of heart disease. I guess you can surgically change your sex, but you can't change your genes. You cannot change your age, and you certainly cannot change your family history of heart disease. If mom has heart disease, then she has heart disease. You can't change that. There are some things that you can do, some modifiable risk factors, to include lowering your cholesterol. This is known as, high cholesterol is known as dyslipidemia. You can lower your blood pressure through medication and exercise. You can lower your risk of diabetes by losing weight, by controlling your blood sugar if you do have diabetes. You can lower your risk by losing the cigarettes. If you smoke, get rid of the cigarettes. You can also lose weight, and this lowers your risk for ischemic heart disease as well. Keep that in mind. Symptoms of heart disease in women. Well, it's interesting because women are not aware that they can present with symptoms of heart disease differently from men. This slide depicts some of the areas that women have pain, and because they have pain in these areas that are not typical of heart pain, they don't go to the doctor. And again, this is why women die more often. They have worse outcomes in terms of heart disease than men. If you look at the picture on the right, you see the red spot in the center of the chest. The picture on the top row, all the way on the right, women will present with, quote, indigestion, end quote. And so they'll take a Tums and they won't go to the doctor. And this is typically what we see in our practice, is the indigestion pain. If you look at the bottom row, the very first picture that you see on the left, you see pain down the right arm. You see pain down the right arm. You see pain into the neck. And again, because it's not situated squarely on the chest, women will fail to go to their doctors. So keep this in mind. Women can present in typical and atypical ways. And speaking of typical symptoms, these are what you might think they are: chest pain, fatigue, sweating, shortness of breath, pain in the back, pain in the arms, pain in the neck or jaw, or a combination thereof, nausea, and abdominal pain. These are all typical symptoms of ischemic heart disease in women. A man may present to your practice with just chest pain. Okay, so there's a difference there for sure. Atypical symptoms of ischemic heart disease in women. A woman might complain of indigestion, anxiety, trouble sleeping, or sense of impending doom. We make it a priority to ask women who present to our practice about any weird symptoms they might be having, to include excessive belching in the middle of the night. So keep that in mind as well. I want to briefly talk about elevated cholesterol or hypercholesterolemia and heart disease. And again, most people know that elevated cholesterol causes heart attacks. However, they don't know how. And so I want to talk about that for a moment. If you look on the left, you see three pictures, three illustrations lined up with arrows in the middle. The top is a heart artery or coronary artery with red blood cells. Red blood cells are responsible for carrying oxygenated blood to the heart muscle, and that's normally how it works. Someone with coronary arteries like those depicted in the top illustration are not having chest pain. Now, in the second picture, what you start to see is a buildup of cholesterol in the lining of the heart artery. Okay, it's not in the artery, but it's in the lining of the heart artery. We call that plaque. That's what it's known as in the cardiovascular world, plaque. And again, the cholesterol is contained in the lining of the artery. And you still see red blood cells getting through, and those red blood cells are carrying oxygen. However, these red blood cells getting through are limited. And so typically what you'll notice is if your patient is sitting there, they're doing fine. They'll say, yeah, I'm sitting there and I'm fine, but the minute I get up and I start walking around or doing anything, I get short of breath, or I have chest pain, or I get nauseated, or I have neck pain or arm pain. And that is what we call ischemia. And basically it's lack of oxygenated blood getting to the heart muscle. As you sit down and do nothing, you have it looks like 3 red blood cells coming through. So you don't necessarily experience those symptoms. But when you get up, and you become active, all of a sudden 3 red blood cells with oxygen on them are not enough, and that's when you start having pain. Okay? And in the third picture, what you see is the plaque has ruptured. Okay? The plaque has ruptured, so the cholesterol has burst out of its encapsulated area and is totally blocked off any blood flow going down the heart, going down the coronary artery. And what you start to see is platelets adhering to the plaque rupture. This patient is having a heart attack. This patient will present with symptoms of nausea, vomiting, sweating, chest pain without activity. This patient might even die on you, so keep that in mind. The picture to the right that you see is a picture of plaque inside the lining of the coronary artery. You see the heart, and those red vessels on the heart, on that picture of the heart, are coronary arteries. And then you get a view inside the heart artery. And again, as the plaque ruptures, you get total and complete blockage of blood flow, and that, by definition, is a heart attack. Okay, so keep that in mind. What can we do? What can women do? Well, as a provider, we can make sure that we reiterate to women that they need to avoid tobacco products. They need to be more active. They need to choose good nutrition. They need to avoid alcohol and stress because all of these are modifiable risk factors. They need to maintain good blood pressure and control their diabetes if necessary. Thank you so much.